Good afternoon and welcome to your weekly town hall meeting here at TRICARE 2, the center of the aerospace testing universe. If you're tuning in for the very first time, I am Gwendolyn Foster, your Med Group Commander, and with me is Captain Lankert, our Public Health Officer, Lieutenant Colonel Bonzo, our Physical Therapist, Tech Sergeant Ott, our Lab Technician and Chief, as well as my right-hand woman, Chief Bradley. As always, we want your questions and want to be able to answer your questions. So as we are giving you that much-needed information, please be sending us your questions through the number that you're seeing flashing on your screen. With that, I'm going to turn it over to Captain Lankert to give you that current situation update. Captain Lankert.
Awesome. Slides, please. Okay, so this is the overview of COVID right now in the United States. As you can see in the bottom left-hand corner, we have 21 states now reporting more than 10,000 cases of COVID. This is up by 2 states from the last time we met at this town hall. It was 19 last time, so COVID is still a very real thing, and it's definitely spreading still. Top left corner is just your same case definitions, things to look out for as far as COVID symptoms. These were revised by the CDC a week or so ago. Of note as well, in California news, by this weekend, California is looking to unrestrict some of the some of the business restrictions that have been out there. This is kind of just an alert. You can find this on the California Department of Health's website as well. But they're going to be reopening with some conditions: bookstores, clothing stores, florists, music stores, places like that to do to-go service only. And then the outdoor parks and recreational facilities are also going to be open. Again, all of this is going to be with the consideration of still having to do social distancing and still wearing a mask as appropriate per California and CDC guidelines. So that's kind of good news. Looking forward to the weekend. But next slide. So this is going to be your local picture. We've seen this graph a couple of times. COVID still continues to rise. Kern County is kind of evening out a little bit, but overall it's still a pretty steady rise. LA is obviously still hit the hardest because they're the biggest city center. In the top right corner, you can kind of see our really immediate surrounding area. Cal City, Rosamond, and Tehachapi have less cases. Lancaster and Palmdale are really driving that. So it really is outside of our gates, which makes practicing the social distancing, hand washing, all that good stuff, still the number one way to prevent COVID and still very, very applicable, even if you live on Edwards Air Force Base. So some other key points from that still is testing or not is going to impact what the data shows. So this is still going to be underestimated. That's generally across the entire United States. So we're not capturing everything because there's not a robust and fully utilized testing system out there quite yet. And in general, you're going to have a lot of people with COVID that have really mild symptoms that don't necessarily even get tested. So assume that all the numbers are pretty much underreported. As well as that, deaths and cases continue to rise. Right now, we're at about 22,000 new cases a day and 2.5K deaths a day as well. However, again, there have been some impacts from the social distancing, which is still what we're trying to push here at Edwards immensely as well. California is doing the same thing, but they are considering opening up with those restrictions still in place in a safe manner. But otherwise, that's pretty much our site picture for this week.
Thank you very much, Captain Lankert. Next slide. And as you see this slide every week, this is our services that we are offering. Again, everything is open, although it is degraded right now because we are in HPCon Charlie. With that being said, as you heard Captain Lankert say, the state is starting to reopen. So as we monitor that closely and as we start seeing cases decline, along with our healthcare systems being able to maintain open capacity to be able to take COVID patients, as well as us being able to have that robust lab testing capability, we will start opening up more of our services and bringing more things online. So continue to watch this slide as we paste it on our Facebook page, so that way you know real time what is available. Next slide. And I'm going to turn it over now to Tech Sergeant Ott to talk about some of our testing capabilities.
Hello, good afternoon, everyone. So this is a quick reference guide about COVID-19 testing. I'm going to go over the laboratory portion. So how long does it take to get results? So once you have your sample collected, it then goes to the lab, and from there you have 2 to 3 days before your results are returned back to your provider. And is there a way to expedite your results? Currently, no. Usually we can run a sample stat or ASAP if we do it in-house testing, but since these get shipped out to our reference laboratory, it's in their hands and we play by their rules. but I can assure you that they are treating every sample as a priority, and they're working 24/7 to get those results back to us. Once they give the results back to us, we'll give them back to your provider, and then your provider or someone on their team will call you and notify you of your results. So antibody testing for COVID-19. Currently, we don't have any in-house testing capability. We do have one reference lab who just validated their test and is offering that to us. And then the other reference laboratory is still working on their validations. But the one that opened up their testing for us, we requested more information, mainly the accuracy of the results. We want to know how sensitive the test is, what study they did for their verification, their validations. Until we receive those results, then we'll move forward with testing. All right, next slide.
Alrighty, so this slide is just saying how you contact us. So again, we have turned on our TRICARE online patient portal. So if you need a routine appointment, you can just go to TRICAREonline.com and you will be able to get that schedule, even if it is a virtual appointment. And as always, if it is COVID-19 related, please call our appointment line so that way we can get you connected to the healthcare that you need. Next slide. And now I'm going to turn it over to Lieutenant Colonel Bonzo, who's going to talk about some things you can do to remain resilient when you're at home.
Thank you, ma'am. First thing we do is, I've heard it saying a whole lot lately, I've put on the quarantine 15. So what we want to do is there's lots of ways that we can combat that. One of them is exercise at the house. Now, you don't need a lot of weight to do that. The good news is you have one of the best exercise equipment machines, and that's just you using body weight. There's also hundreds of options out there. You can use your phone. There's Apple and iPad and Android all have many, many free apps out there. I have a streaming service called Roku, and on there are also several apps on there for yoga and lots of different options as well. Google, just type in a word, type in calisthenics, type in yoga, and it'll pop up several hundreds of thousands of different exercises that you can do in your home by yourself with just using body weight. Next slide, please. So no equipment needed. I brought with me some toys to play with and show you a couple things. But again, one of the best things you can use is just use your body weight. Many things don't need weight. Lunges, squats, split squats, push-ups, jumping jacks, and the list goes on, don't need anything other than you. And so using your couch, using your bedroom, you can use anything to do many of these exercises. But if you want to get some specific stuff, you can grab some toys around the house. I brought with me some cans, an old backpack. I know something that we all have out in the front yard is big rocks. They all have weight. They can all increase resistance to it. So what I'd like to do is demonstrate a couple things really fast, show you some ways that you can be creative around the house. And the biggest thing is be creative. Like I said, you don't need a lot of expensive equipment around the house to do things. So first things I brought, 2 milk jugs, fill them full of water. This one weighs about 8 pounds when I weighed it. If you put some sand or something heavier in it, it's going to get a little bit more weight. This one weighs about 5 pounds. So they have great handles, easy to do lots of different exercises around the house. You can use the arms, the shoulders. You can do all kinds of things. You can hold on to it and do squats and standing. You can also, if you haven't been doing much exercise at all, go to something a little smaller. Can of green beans, from Kentucky, by the way. But same thing. You can do lots of different things with that weight to kind of give yourself some resistance. We'll stand up for a second and demonstrate a couple things. If you have a step in the house, some stairs, a little step stool. My wife's very short, so we have several step stools so that she can get into the upper things. Just doing a little step up will help with the quads. Think of it like a Stairmaster. And when you go to the gym, you can do aerobics here. If you have stairs, just go up and down the stairs 10, 15 times. Make sure you're healthy to do those things, but use the equipment you have in your house. You can also use the broom just to do squats. Now, this is a great exercise to help stretch your back out, but just bring the arms overhead and then squat down. Go to a range that doesn't hurt. Don't hurt your knees, but gradually ease into those exercises. Most people have backpacks. Easy to put a lot of load in them. Put them on your back, put them on your front, and again, use your body weight with a little extra weight to give you some more resistance. Grocery bags. Now, I mean the good kinds that have good handles on them. They can all be stacked full of stuff and create weight to where you can use more resistance through the arms or legs. I guarantee we've got a couple of these out in the yard. I can do lots of squats. I can do biceps. I can do overhead stuff. The list goes on, and it's all about how creative you can be and just grabbing the stuff that you have in your kitchen, in your garage, that can also give you some resistance with exercise. Another good place is Corvius. If you live on base, they have a nice little obstacle course that goes around the back with lots of different stations where you can do pull-ups, where you can do push-ups, where you can do all kinds of things, maintaining social distancing, and still be active and fit. So, next slide, please. Well, the next slide, when it pops up, are a couple of links to some exercises that you could do that are through Google. One of them is through the Air Force Medical Services app, to where you can just log on to those, post those links. They're there. You can post those onto your web browser, and can pop up lots of different exercises, all body weight, no equipment needed, and still get you a good workout from a cardio standpoint, from a high-intensity workout, core strength, all those type of things where all you need is just your floor. That's it for me, ma'am.
Thank you, Lieutenant Colonel Bonzo. Next slide. All right, so we're about to turn it over so we can get your questions. But again, we are all in this together to flatten that curve. Even with Governor Newsom starting to open the areas around us, you heard Captain Lanker say it is important to maintain that social distancing, that physical distancing, while we continue to connect. And while we're doing that, again, please remember to wash your hands, cover your cough, and stay home if you're sick. And that will continue to help us get that curve flattened, where we can get back to our normal operations, which we are definitely trying to do it quickly and as safely as possible. With that, I'm going to turn it over to Chief Bradley for questions.
Thank you, ma'am. All right, we haven't had any questions come in yet over the text number you see up there on your screen. So go ahead and start sending those. For those who are just tuning in, we have a few experts here with us. We have Colonel Gwendolyn Foster, our Med Group Commander. We have Captain Aaron Lankard, our Public Health Officer. We have Tech Sergeant Dolores Ott, our Laboratory Flight Chief. And then we also have Lieutenant Colonel David Bonzo, our Physical Therapy Flight Commander. So please text those questions in. We do have one question. How close are we to getting antibody tests in our own lab? Or how close are we for any kind of in-house COVID sampling and testing?
Tech Sergeant Ott.
Hi. Okay, so what I forgot to mention is the BioFire. Did you say antibodies or did you say COVID-19?
Both, ma'am.
Okay, so let's focus on COVID-19. So there's an analyzer called BioFire, and we have been trying to get this analyzer in-house to allow us to test in-house and to give those results faster. However, it's been on back order, but a local guard unit in Fresno has agreed to let us borrow theirs. So we are working on a MOU to get that in-house testing capability done with their analyzer, and hopefully we can get that in next week. The other piece to that is I still need to, we've already ordered the reagents and the testing kits that go along with that analyzer. We just need to wait to receive all of those reagents so we can start our own in-house validations, and then testing will be available. So we're hoping in the next couple of weeks, but that really does rely on our supplies. How fast can those come in? And as far as antibody testing, we're not sure. So the one lab is testing it right now. We are just waiting for their validations. We want to know their studies because we want to make sure we're giving you accurate results. We don't want a result to come back and we have to question it or we don't really know how to interpret it. So as soon as we get that information and it's good information, then we can open up antibody testing. And that'll more than likely start out as a ship out. And right now, a turnaround time would be 2 to 3 days. Thank you.
Thank you, Sergeant Ott. Question for Captain Lankard. Do you foresee a second wave of COVID happening now that states are opening back up?
All right, so that's an excellent question. That's what a lot of public health professionals have been talking about for quite some time now. So we got a couple of things happening. COVID going away and or lessening is going to be completely dependent on people doing what they're supposed to do as far as keeping themselves healthy and avoiding infections. So if we keep social distancing and we keep using the masks per the CDC and not congregating and basically cutting off that ability for the disease to spread, even as states start to open up, and it's done in a very thoughtful way, there's a less of a possibility of that second wave. However, the second wave concern does come up, and it's something that's very real on our mind as well, because if states do start to open up, and they start to do it in such a way that doesn't necessarily have these protections still in place, then it goes back to us being as susceptible as we were basically pre-COVID, where nothing has necessarily changed. The disease can basically spread kind of however it wants. So a second wave is definitely a concern, which is why here at Edwards we're watching other states and other bases as well, kind of seeing what they're doing, taking a very meticulous approach to it, see what were the reactions to that, were there any case explosions from it, one would say. I know in Florida when they opened the beaches, there was a pretty big spike in COVID cases here back a couple weeks ago. And then therefore they were considering reclosing them and adjusting from there. So the other consideration for a second wave is going to be flu season, which is right around the corner, even though it seems like it's very far away. But the past 3 months have gone pretty fast already. So the next 3 months are going to go really fast as well, I'd imagine. But flu season is going to come up, and once that hits, that's going to basically further complicate the situation, is what one of the concerns are. So what you're going to have at that point is you're going to have COVID still around most likely, and you'll also have flu on top of it, which they both have very, very similar features, similar disease presentations. And so that's going to add kind of a wrench in the system where we might see another spike, both because we have now flu going around and now the other states may or may not be opening up in certain ways that isn't as conducive for COVID kind of going away and not spreading as much. So, I mean, in short, yeah, we're very concerned about that. We're watching and we're waiting, just like how big public health, the CDC is watching, even the World Health Organization is watching what individual countries are doing at one time. But it's definitely a very real possibility, which is why I know the governor and definitely the base commander are both going about this in a very, very meticulous, measured, let's wait and see type way in order to make sure that, as Colonel Foster said, the risk is absolutely minimized and it's done in the safest way possible. So, yeah.
Thank you, Captain Lankford. Okay, we have another question that just came in. The BX is selling N95 masks. Are they washable? Can they be used more than once? And why $5? I'll go ahead and answer this one. So the N95 mask is actually considered a respirator. So for those, we do try to save those for people in healthcare settings, as those provide a higher level of protection that people need if they're doing something where there's going to be a high risk of airborne droplets that are actually aerosolized and can be inhaled. So normally that's overprotection. You don't need that just for normal day-to-day duties. So we recommend that face cloth mask covering because then you can wash that as many times as you want. You can launder it in a normal washing machine with normal laundry soap, and we recommend doing that at least once a day. As far as the N95 mask, you cannot wash those. Those cannot be laundered. There's really no way to clean those right now. There's different experiments going on with, hey, can you blast them with UV light? And maybe that would sanitize them, but nothing's proven yet. So we'll stay tuned to look for that. And then as far as the price, again, just it being a higher level of protection than like a paper mask or that cloth face covering. But for the general population, cloth face coverings are what's recommended. Okay, I don't see any more questions yet. One of the things people are concerned right now with is kids coming home from college. You know, maybe they're all virtual now and they're trying to leave their dorms and come on to base. What does that mean for our members who are here on base? Are there any special precautions that somebody would need to take once somebody outside of the local area has come into their homes?
Captain Linker.
Okay, yeah, so there are a couple of precautions you can do. That's whether someone's coming home for college, coming from outside the local area just to visit, whatnot. So basically, the first thing to do is basically that individual and your family should just be aware of any symptoms developing, because depending on where that person's coming from, they could be coming from a place like New York City, they could be coming from a place that's just outside our actual boundary. But basically, as long as that person tries to, I guess, the phrase would be basically separate themselves from going to major gatherings, make sure that they wear a face mask when they need to, just like how everybody else is on base. Do that social distancing. There really should be a minimal risk. It's just watching to see if that individual either starts feeling ill, in which case they should definitely seek medical attention ASAP. Or if anybody in the family after that person comes to visit starts to feel ill, again, they need to contact their provider. Right now, we don't know who has COVID and who doesn't, essentially, unless we test. So as long as we treat everybody in that same risk category of saying, okay, well, this person may have been exposed, we don't really know at this point. But we end up countering that by pushing the face mask wear, pushing the social distancing, make sure you do the hand hygiene, washing your hands, doing all that. That should really minimize any sort of risk from that. And then once the person has been here for 14 days, they're pretty much that anything they would have gotten from wherever they were at would have shown up by then, because that's the incubation period for COVID as well.
Thank you, ma'am. Is the CDC going to make it mandatory for kids to wear masks? If so, is the base going to provide the masks for the kids? This one we can't really answer from a medical perspective, but we can at least address what ages are required to wear masks or recommended. Captain Linkard?
As far as what ages are, that's kind of hard to describe because I don't know what the CDC's policies are going to be. Obviously, if it's safe for the child to wear a mask and they're not going to harm themselves, or it's not going to obstruct their breathing ways, then they can wear a mask. But I think that's going to be very much on a case-by-case basis, and then whatever the CDC themselves decides is local policy. There isn't like a necessarily a broad do it if you're at this age. It's really dependent on the child's physiology, what their risk factors are, and then what the actual in-house policy is going to be from the CDC.
Thank you, ma'am. And right now the CDC does recommend ages 2 and over is that age for masking up. A question, are gates going to be open to retirees and dependents every day now? And that answer is still currently only Wednesdays for retirees and their dependents until our HPCon changes or another directive is given out by Colonel Heiger. That is all for our questions currently. Does anybody have anything they would like to kind of readdress? Okay. There's still time to send your questions in if you have those. One question we do get frequently, I guess, physical therapy. Are you still able to see, what kind of appointments can you see now?
We're still seeing our post-op patients. If it's a new post-op, which is kind of rare right now because they have stopped some elective surgeries, but sometimes there are still emergency surgeries that are still going on. So we are seeing mostly post-ops and acutes only for right now.
Thank you. Our pharmacy operations, we could talk about those for a little while. Wednesdays, we're seeing retirees. The big key to that is that you have to have an appointment. So for our retiree population out there, make sure you're calling into our lab. That number is 661-277-2052, and they will make you an appointment for the following Wednesday, as long as they can get your meds in by that time. And then the process is very simple. You come in through our entry control point. They just ask you what you're there for. If you have that appointment time, they send you on up. You'll drive around our clinic building to a small tent we have set up, and they will deliver your meds to you curbside. For everybody else, you're still able to go get your prescription as long as it's been filled. So you want to make sure you call ahead, and it'll be refilled the next day. There's no same day refills unless it's an emergency. For now, that is all the questions we have. Colonel Foster, did you want to wrap things up?
All right, so thank you again for tuning in. We are here for you. As you heard us say earlier, we continue to strive to provide that health care you need at the right time and at the right place. We're looking at increasing our lab capabilities. Our utmost priority is keeping you and your family safe. So even as things start to reopen and we start to bring more services online, we will make sure to prioritize that to continue to keep you safe through the COVID crisis, as well as even post-COVID. So once we are more at a stabilized position, our team will still be ready to be able to provide that testing, as well as that contact tracing and that quarantine processes that we will need post-COVID, because just like with flu season, it is possible that we will continue to see COVID throughout. So with that, we are here for you, and we look forward to seeing you next week at your weekly medical town hall. Thank you.